Hey guys, welcome back to the channel. Today I am showing you 3 really quick and easy scapular stabilization exercises that you can have your patients do. So I don't know if I've talked about it necessarily before, but in the clinic that I work in, we really only focus on patients that have elbow to the fingertip injuries. We don't really treat shoulders that much in the hand therapy side because we have physical therapists that we work with, and most of the shoulder patients get referred to them. But I find that a lot of patients that have upper extremity dysfunction, so things like repetitive strain injuries, even fractures, carpal tunnel syndrome, cubital tunnel syndrome, tennis elbow, all those kinds of repetitive strain injuries, a lot of times actually have shoulder dysfunction, and that can make, first of all, if we have a dysfunctional foundation, right, if our shoulder is not a stable place, our arm is not going to be able to interact with the environment in a healthy and safe way. So if we can control the shoulder, if we can kind of stretch out, most people tend to have kind of, forward head, forward shoulder posture. They tend to internally rotate their arms and kind of have that slumped kind of like tech neck posture. And so everybody is really tight in the pecs. So if we can stretch out the anterior chest, right, like doing your doorway stretch, and then we can then strengthen the posterior capsule, like the rotator cuff muscles, the lower trapezius, the middle trapezius, all those muscles that kind of hold us back and keep us stable, we're going to have better interaction with the environment down the chain. So I tend to do a lot of scapular and proximal stabilization exercises for my patients, and I just explain it to them just like that. Like, if we're not strong here, we're not going to be able to interact correctly with our environment and with our work tasks and everything that we do. We're not going to be safe down the chain, and that's going to put you into postures that can cause repetitive strain injuries or other types of injuries as well. So I'm going to show you the isometric stabilizers that I tend to use a lot. Of course, these will not be appropriate for every patient. They're going to need to be able to have enough range of motion, at the very least, to be able to get to kind of that 90 degrees. You could do it a little bit lower, but to really truly activate that posterior capsule, the rotator cuff so nicely, and all of the rhomboids and everything, you're going to want to get them to at least 90 degrees of shoulder movement. So it's not going to be appropriate for every patient, but I do like to try these for a lot of my patients because all they need is a wall where they can kind of spread out their arms, so they can easily do it at home as well. So the exercises I'm going to show you today are called X's, Y's, and T's. Okay, so let's get into it. Okay, so bear with me. Hopefully the framing of the screen is going to be okay to show this exercise. Essentially what you are going to have them do, I probably usually start with about 5 repetitions, holding for about 3 seconds, and see how they do. You could also hold it for a little bit longer and do a little bit less repetition, see how they feel with that. And you can kind of work your way up from there. So I'll either have them do 5 reps of 3-second holds, or I'll have them do 3 reps of 5-second holds usually to begin with. The first exercise I'm going to show you guys is the T exercise. So you want them to kind of be good posture, shoulder, hips and feet should be about shoulder width distance apart. You're going to have them come back against a wall. They're going to stand really nice and tall, show off their anterior compartment. So hopefully, ideally, you want to stretch them out a little bit first, doing a doorway stretch or foam roller stretch, whatever you can do to kind of lengthen them out that direction. Have them come up against the wall. They want to roll their shoulders down and back, keep them nice in their pockets, keep their chin tucked back so it's not sticking out here. Okay, and then you're going to have them engage their arms to about 90 degrees. Sorry, you can't see my arms. Let me move over. See if that's better. That's better. Okay, so they're at 90 degrees. I don't know if you can tell from the angle, but then what you're going to have them do is they're going to push the back side of their hand into the wall just lightly. They're going to push and they're going to hold for 3 to 5 seconds. And then they can relax. They're going to repeat that 3 to 5 times, depending on how much you want them to work. And in pushing against the wall, you're really going to be able to feel it. I mean, it's a very strong contraction. You can feel it all through the rotator cuff. You can feel it a little bit in those rhomboids, the middle trapezius, everything pulling you back. So that's the T exercise, right? Because it looks like the letter T, okay? And then the I exercise, X's are next. I don't know why I said I, that's not even a thing. The X's are gonna be kind of like in the shape of an X, right? So you want their arms to be at a diagonal up and a diagonal down. So, oh, you can't really see me. Okay, like that. So again, kind of that direction, right arm up, left arm down, like a 45-degree angle, I guess. And again, pushing through the back sides of the hands for 3, 2, 1. Repeat. And then the other side, same thing. Left arm up, right arm down. Again, pushing, engaging. They'll get tired from this for sure. Okay, and then the most kind of advanced in terms of shoulder range of motion is, of course, the Y exercise. So with that one, again, you're going to be hands overhead. This one, thumbs or the back of the hand pushing the wall, not necessarily the outside of the hand. So for the T's and the I's, I usually have them use like their ulnar side of the hand to push. They could also use the back of their palm. It just depends on what they're most comfortable with. But with the Y's, you really want to get them up, thumbs up or palms back. And again, pushing, engaging. Make sure with that one, they're not hiking their shoulders up too much. So trying to keep their shoulders down, raising and pushing. And they will definitely get worn out from this, you guys. These are definitely difficult exercises. They will make you tired. They will really work your back and your shoulders. And it's going to help train the shoulder blades to be in the right position so that they can then interact with their environment. So hopefully that made sense. Please comment below if it didn't. Ask questions, whatever you need, or share more information. Obviously, these are just a few of the scapular stabilization exercises that I choose to use. I also tend to have people do a lot with TheraBand once they are feeling pretty good. You know, we start pretty light. We'll do like kind of rows, pulling back. We'll do external and internal rotations. I tend to do a lot of PNF diagonals too as patients get better or kind of are starting to improve. I like to use PNF diagonals too, coming across the body with a TheraBand. And then of course, I think if you have access to like a mat table or like a treatment table, and your patient is willing to and able to lay kind of on their belly, you can of course do like kind of your scapular stabilization exercises unweighted or weighted. So you can do, again, kind of I don't think I can really even show what I'm supposed to do here, but lying on their stomach, right, prone, and they're going to lift the arms up to like a T position or a Y position or the I position. I don't know why I cannot remember what those exercises are called right now, but I will look through my book and I will find the name and then kind of link the name below in the details, like the description box. Wow, brain fart. Can't remember anything right now. It's okay. But I will write that in the description bar too. You can do those without weight and just the movement of the arm, or you can do them with a TheraBand or weighted, however you want to do them, and kind of grade it as appropriate. But there are tons and tons and tons of scapular stabilization exercises, but these are 3 that I tend to use a lot in our practice because we don't always have access to a mat table or a treatment table that we can work on. So everybody has a wall that they can find somewhere in their house or on the outside of their house, in their backyard, whatever they have. So hopefully you guys enjoyed the video. Thank you so much for watching, and please like the video if you enjoyed it. Please subscribe to the channel if you want to continue to see all the hand therapy content that we're starting to put out. Hopefully starting to build this little community, this little corner of the internet that we love so very much. I'm so out of breath. Whew. Your patients are gonna love you. Anyway, thank you guys so much for watching, and we'll see you next time.